I suppose for eating, healthy eating isn't, again, really my thing, but I have noticed with dairy I do get a much thicker cough. So I've tried to have soya milk for cereals and things as much as possible, and fresh food, and drink lots of water, but not half as much as I should.
In terms of diet, I found it really useful to cut certain things out and to experiment with things like making sure my nutrition is really good. I mean, I don't know what the medical basis might be for it, but I've found for myself things like dairy and possibly white bread really make me they really make me fill up. I mean, if I eat something cheesy, I'm likely to be deaf for the evening, things like that. So I've managed to avoid eating too much dairy produce, and I think that helps. And the other thing is, we all know about needing to keep a balanced diet, and we all know how helpful it is to do that just for general health. But if there's a risk of getting chest infections, things like that, having your body on top form is really important. And things like multivitamins and stuff like that are easy to fit into your day, and it's not a drug, it's not going to harm you. It's just going to help you keep you on top form, despite falling in through the door and grabbing a pizza and a glass of wine every day.
So when I have made a diagnosis of primary ciliary dyskinesia, I talk to the patient about how they should try to stay well. I try to explain to them what cilia do. So cilia are small hairs on the cells of the airways which move backwards and forwards about 14 times per second and drive the secretions out of the airways. And so if you inhale any particles, including bacteria, it sticks on the secretions, and then the ciliary beating drives the secretions out of the airways, rather like a vacuum cleaner, keeping the airways clear. If those cilia are not working, then the secretions build up in the airways, and that can lead to infections, either in the airways in the lower respiratory tract, or in the ear, or in the nose and sinuses. So much of the way that the patient can stay well is to keep those secretions clear. And for the lung, that can mean physiotherapy, and performing physiotherapy exercises regularly twice a day to cough up the secretions. But often patients also like to adopt exercise, because that's just really as good as physiotherapy in clearing the lungs. And whilst physiotherapy is boring, even if you're watching EastEnders or something like that when you're doing your physiotherapy, actually exercise is a fun way of keeping your lungs clear. But life being what it is, you can't do exercise perhaps every day, either because you work most of the day and when you get home you're too tired to go down the gym, or maybe for other reasons, for example if you're travelling on your job. And so what I say to patients is that every day of your life you have to do one or the other. You have to take some vigorous exercise, and that's not just a walk to the shops or a walk to the pub in the evening, it's a workout in the gymnasium or a game of tennis or swim 20 lengths, good exercise to clear the lungs, or if that isn't practical, physiotherapy. Now another important aspect is even with very good management, we all get chest infections throughout our lives. I've had a couple this winter, which has been an awful winter for chest infections. With primary ciliary dyskinesia, that is going to be a more significant illness, and you are less likely to clear the infection yourself, so prompt antibiotic treatment is important. And I give patients advice on which antibiotics work best. For the nose, the problem is the same. The secretions don't clear themselves easily, and so one approach can be to douche the nose using a salt water spray. Spray the nose, a couple of puffs each side when you get in the bathroom, brush your teeth, like me, have a shave, and about 5 minutes later give the nose a good blow, and you just clear in the secretions, the equivalent of physiotherapy for the chest. And perhaps lastly, ears can insidiously get worse, so it's important that all patients with primary ciliary dyskinesia attend an ear clinic and have occasional tests, perhaps once every couple of years, to make sure that their hearing is being maintained.